we've been working with University Hospital Limerick Group for about the last 6-7 years now. It's a 6-hospital site just off the Midwest of Ireland there. And it is, as all of the hospitals are in Ireland, trying to come together as a group and then ultimately a trust. It has a total of 760 odd beds. So it's not a large group, but obviously at the same time covers all of the key areas around emergency, surgical, etc. And it's still covering a population of close to 500,000. And it's a very active and progressive. And we got involved with Limerick Hospital in the first instance to look at their overall quality and safety system beyond QPULS. So we carried out a quality and patient safety management review to look at all of their structures, processes, and outcomes in relation to how it was looking at. And when we looked at this, this was a hospital that had QPULS for a lot of years. And it was one of the things that we looked at around their incident management, around their document control and audit. And again, unlike in the north, the south does not have any point of occurrence entry incident management system nationally. It has a national incident management system, which is for administration access. So we're looking at a lot of people are using paper. But around document control, it was really unknown how much people were utilizing it. But from an audit, we found there was a significant number of outdated policies and procedures in the hundreds. The updating of staff members was very poor. There was no defined process with regards to the governance of who should approve policies and procedures, at what level that the various ones wanted to go. And similarly around audit management, there was no process defined for it. And it was unclear what audit was going on within the organization. So we took that on board and we worked with them over the next number of years, starting off in 2016, working with the senior management team of the group and really looking at the overall processes around policy and procedure approval, audit management, be it internal, external, clinical audit, etc., around incidents, complaints, and risk management. Now, interesting, and I alluded to this earlier on, one of the drivers behind this was the laboratory and the lab. The whole pathology department had really come a very structured QPULS system. And it was the hospital management team looking at how well that was utilized for regulation, etc., that they really said, well, okay, if it's working well in the labs, we need to get it further out to all of the hospitals. And again, that was the champions that were with us as part of that. So the whole QMIS restructuring took approximately 4 months through process mapping, through agreeing our configuration, our classifications, and how we were going to reconfigure it. Then we had all of that data to make sure that it was uploaded, all the staff were actual users in it, and then a full launch campaign with regards to communication and to get people to understand what it was. When we started to embed it, and then over the next 18 months, we found that for those, and I mentioned this already, for those who were only using it on occasion, they found it a bit clunky, trying to find policies and procedures and where their audit was, and the incident reporting wasn't very intuitive. So we developed, HCI developed simple user interfaces for this, which I will show you, which meant that in the case of finding a policy and procedure, people didn't need their username or access in relation to logging an incident or complaint or an audit request. They didn't need a user login requirement for it. Obviously, with regards to incident management, they still had that requirement for it. So then as we progressed, once we got really core into the data analysis or the core into the functional aspect of it, then at a governance level, said we need a better oversight of this. And originally we were, because the analysis wasn't great in QPULS, we were downloading everything into an Excel spreadsheet, converting it to a PDF, making it look nice and sending it back to the management team. But in 2018, we undertook the development, again, of business intelligence engine, what we call QualSIP, to be able to give more information around that. So that was key at that stage. It has continued to progress with regards to our enhancements around our dashboards, around trending around the national incidents, and also expanding it. So last year they have expanded the use of it around their information governance office, their freedom of information office, etc. And we introduced a lot of web training forums as more and more staff were getting involved. And then at the latter part of last year, midway through last year, we also had to work with them to develop some of the clinical audit processes and a web form which would allow for saving. So it was something outside of QPulse that it would allow people to log a lot of information around their clinical audit proposals, save it, come back to it before they actually submitted it to it, and then that the QPS would be brought out. One of the other things when we talk about the dash mail there is we spent a lot of time working with them on alerts and how to get that information out. So it's a case which had a real impact on the incident management, was that when something is closed off, so an audit or non-conformance or an incident or complaint, that the email went back to whoever had reported it. And then they were given an opportunity to engage directly with QPS. So rather than just telling them what happened, they said, look, we have a clinic every second Tuesday in room 101, come talk to us about it. And that got a significant amount of positive feedback in relation to how QPulse was providing the information for them. So how did it work, and where did the success come from? Well, one of the big things was, and there was a reference made to it, was our interface that we designed. And this is an example of the interface, which I'm going to show you, which you can see here is designed for the organizations themselves around what are the key categories. And they can use this on their phone as well. And it is a very simple aspect of, I need medication management policies, nice big icons on it. I click on it, it pulls from QPulse, it lists all the documentation. And you can see in this, it talks about what version they are, whether they're Word or Adobe or whatever. And then I can always go back. If I want to look at sound alike, look alike, I can pick something and I say, okay, that's what I want. That's the list. And there I go. So essentially 3 clicks with my thumb, and I'm getting the information that I want out of the system. And that was the turning point in Limerick for people who said QPulse is terrible. I prefer to Google than to actually access policies and procedures. They don't require logon. They know where the policies are. And from a governance point of view, then in the background, that is continually being maintained, making sure that the people are accessing the correct policies and procedures and the right areas that they need access to. So it has come on a long way. It has been a good success in relation to it, and provided that simple interface. So we had a look at the end of last year. On average, now we're getting 132 over the 12-month period policies and procedures being accessed. So our logins, and you have an average of 69 policies and procedures per day. And you can see there with regards to audits as well, it has increased. So it wasn't just one thing. First of all, it was making sure that the content within the QPulse system was actually up to date, which it hadn't been. The administration had fallen well behind. Then we had to look at the processes around how that should work and who should get notified and what emails should go out, and people getting too many emails versus not enough emails. And then, as I said, a major breakthrough was that we wanted a simple interface to access the policies and procedures around that would link back to QPulse. And this is one that they can use on their website as well with front engagement if it's part and parcel of it. And you can see there, we just on the incident reporting, which I know isn't relevant to this discussion, but we also designed dynamic forms so that for the information management system that it would open and close depending on the selections, which again QPulse wasn't able to do. So we worked a lot with the organization. We worked around no one was really clear on where the audits were, what was being carried out. So again, it was about the process, but it was also about education and training on audit. And when we are providing our education and training, be it on policies and procedures or audit or incidents, it's looking at the management of policies and procedures utilizing Q-Pulse, the management of audits utilizing Q-Pulse, rather than telling people about the technical aspect of it. So Q-Pulse was something that we worked on. You'll see there in the slide, I looked a lot, or we looked at developing the clinical audit form. So again, a web-based form that they could save the information on before it was submitted, and once approved, then to create a form, an audit schedule. You can see there, just in that very simple example, Trina was mentioning about when a audit is taken offline to work on the app. You can see there the little yellow icon comes up, so that is locked because the hand hygiene audits are being worked off on the audit itself. So this work occurred. We had a fantastic response, and again, this is just one indicator with regards to incidents reported, and the hospital group themselves published this with regards to the significant move from 615 to 1400 over a 2-year period, and we saw that reflecting as well with regards to a 400% increase in the number of audits recorded. Now, were there audits going on before that? Absolutely, but we weren't able to track them. And most importantly, and I don't have to tell you this, most importantly, it was about we weren't able to track the quality improvements that resulted from them. Another aspect that was key to the success factors in Limerick to date was that we, as I mentioned earlier on, we have a HCI support desk sticker on every PC in every hospital site, so that every frontline staff member can contact. And because our support desks are quality and safety people, yes, they can sort out the password, but they can also sort out, what's the format of the policy and procedure. Who do I need to get it approved? And on a policy and procedure level, our support desks become the gatekeepers. So this is a managed service. So there are no central administrators in Limerick. It's all through HCI. And then when we get a document, an email document to upload onto the system, we work with the staff member to say, well, it's not in the correct format, or you don't have the correct information, or we need to put it through a different approval process. So it's to work with all of those. And you can see the number of cases there that was in over a 12-month period up to the middle of last year, but also equally for us is the rating. So that's both a phone and email support and centralized administration system. And in addition to that, as I mentioned, we then sit every 3 months with the quality and safety team and discuss how things can be improved and where we can go from those. So there's been a lot of engagements. We've supported all of those modules that you can see there, from policies and procedures and guidelines right up to the overall administration of it. We are continually looking at optimization. We work with their IT department on backup and routines and the server management. Anything that is required to make the system simpler, cleaner, and easier to work. And that includes the likes of the training videos, the creating of the champions, the head of departments, and all that goes with it. And in there, you'll see on the bottom right-hand side of the screen, you'll see the sticker that is on all of the PCs that people can contact us with it. The final piece of the puzzle that I want to show you is the QualSIP, so the analysis of the trends of that information that it is providing us. And hopefully you can see this. Now this is mock-up data, but it will give you an idea with regards to it. So in the first case, we have developed, this was in the original development, we have developed the analysis reports for real-time data along the different directorates. Some have done it per site. In Limerick, it is the directorate basis. We can see our dashboards around it if we have a look at the diagnostic directorate at a glance. And this is a bit like, and Ideagen did take some of this, it's a bit like what we're talking about in relation to the 7.0 dashboard. So you can see there today that we have 52 internal audits that are overdue. We have no audits performed this month, and documents that are overdue there over the 6 months to 1 month. So, and that is something that gets emailed to the senior management team every Friday. So they're kept up to date on other things such as open incidents. When we start to look at the reports, then it is much more around the analysis aspect of it. So when we want to see trends, we can say, I would like to see trends 6 months, 12 months from whatever date. Let's say from this one here, I want to see our analysis over our document activity. Then off it goes, and it starts to pull some information. So it's telling us here there are 143 documents active, with 27 overdue and 4 activated for the period, which is the last quarter. And then when I start to get into my audits, or my documents rather, I can see all the different fields. Over here, we've created our little table. I want to see our menu, active documents, draft documents, documents due for review. In this demo, there isn't the one which actually analyzes the acknowledgements, but that's also one that we have for certain clients. And here we'll say, I'm very interested in the ones that are overdue for review. And I can say, right, tell me what document types they are. And there I can see the different types, dietetics. If I click on that again, it will give me the actual document. And if I click on the hyperlink, it now brings me back into QPost so that I can manage them directly. And I can export that to Excel. I might be interested, as I definitely would be. Well, we have 27 documents. Who are the owners of all of those documents? And again, I can have a look, and I know that someone in pharmacy, if I contact them, I'm going to solve a lot of my overdue policies and procedures. So this was important for the governance of the different directorates and the hospital overall, to be able to see. They could start to trend how things were occurring, whether they were the document activated trend or due for review. We were hitting in this mock example in March, we were getting more documents that were due for review. And again, as before, we can drill down who is the author or who's the owner, and that is pulling the information in real time. So beyond that, where do we go? Well, if we look at the audit, we want to look at the same type of information from the audit. And if I open that again, I can see the trends and analysis around my audits scheduled for my make-believe directorate. And here again, you'll see down below, clinical internal. Let's say I'm only interested in internal, I'm not interested in clinical, I'm not interested in the total. I can now switch that off. I can see what departments or what status it relates to. Scheduled, they should be. Some of them are now performed, obviously, because that was back in September. I can click on those again, and they would bring up the internal audits that I have. And again, I have multiple ways of looking at that. I can look at my QIPs that are raised. I don't have any QIPs in my mock data that are raised. I do have some. Oh, I don't have any of my closed. I will show you back in the overall group for my QIPs. We'll have to put a bit more mock data in here. My QIPs raised. I can see the information there. And again, I can see the actual information that is brought. I can see if there are open ones around clinical. I can again see the owners or the status or the risk rating, which is always important. They're low, not rated, or risk. So that brings about really where we were working with both the frontline staff on looking at how they managed and how they got access to it. So 90% of the time, as I said, was people who wanted simple access to their policies and procedures. They want to be able to say it on the phone. Kathy Ryan made reference to that earlier on, that, you know, certainly with COVID, that, we have much more and more remote working. And similarly on the remote working, that line managers want to be able to see that things are being maintained, whether it's the staff training trending that Kathy talked about, has everyone done their hand hygiene? Have we covered everyone on the emergency plan for COVID-19? Or that they were getting updates on their policies and procedures, which were changing hourly, as you well know, and that we were able to get them to everyone, that they didn't have to be reliant on just looking for a hard copy or just looking to get access to a PC, that they could find them quickly, easily, and make use of them. So that's a very quick summary of the project and the success that we've had in relation to Limerick. Around the areas of document control, around the areas of audit management. It has been a multitude of things, from the re-engineering, the simplifying of the system, the remote central administration and governance of the system through ourselves, that everyone has frontline support, that it's available at all times. We have a support desk and a support team. You saw a brief picture of them there, and that our quality and safety team then work as part and parcel of that to bring it forward. So that's kind of covering that example covered a lot of the support services that we do around quality management information systems.